Hey, Future Medics, Tina here, your medic mentor. Today we're talking about a medication that's kind of the OG when it comes to antiarrhythmics in EMS. It's lidocaine, and the brand name is xylocaine. Now, lidocaine might be something you think of whenever you think of the dentist, and you're right, but in EMS we actually use it for the heart because this is a class 1B antiarrhythmic. Here's how it works. It actually suppresses automaticity in the ventricles by blocking voltage-dependent sodium gates. So if you remember, sodium, potassium, calcium, three key proponents of a muscle contraction. By not allowing an item that we need to make the muscle contraction into the cell, sodium, you physically cannot make a bunch of muscle contractions happen because it's dependent on the amount of sodium that you have. So therefore, by blocking it, we calm the heart down because it doesn't have the ingredients to race out of control. There's two things that we primarily use lidocaine for. The first is VTAC with a pulse, so stable VTAC. And the second is VFib during cardiac arrest, if amiodarone isn't available. Third thing you can consider it for is local anesthetic for IO, especially if that patient is awake, okay? Because it does still do numbing. Now, the dose is a little squirrely. For cardiac arrest, it's going to be 1 to 1.5 mg per kg IV or IO push. In 5 to 10 minutes, you can give another dose. The second dose is different than the first. The second dose is 0.5 to 0.75 mg per kg, still given IV or IO as a push. And you can keep giving that second dose until you reach a max accumulation of 3 mg per kg. Now the stable VTAC dose is the same, it's just often followed up with an infusion to keep things at bay. Onset for this one, rapid, 30 to 90 seconds. And the duration is about 10 to 20 minutes. So you want to factor that into your dosing if you have a really long transport. Here's some side effects to keep an eye on. Confusion, drowsiness, bradycardia, and numbness and tingling all over their body because we are giving this IV. Now for your contraindications, it's going to be your high degree heart blocks, known sensitivity, and showing up again, Wolf Parkinson White. That guy's a problem, I tell you. Always ask about it. It's really important. Here's your takeaway. Lidocaine's not used that often anymore, especially in EMS, but it is still in protocols as a backup to amiodarone, so it's important to know. Also, don't forget, you can prime your line for an IO with lidocaine to numb that bone before you start pushing any meds. If your patient is conscious, they will appreciate that. But that's it. That's another one knocked out. You're in the home stretch now. We're almost done with this series. I'll see you for the next one.